My name is Hank, and I'm a student physical therapist. So, seeing you under the supervision of Dr. Clausen. So, we have you in the clinic today. Couple weeks post right ACL surgery, and your pain is well under control, but you're having some extension leg on your straight leg raises. So, that indicates to me that we should use some neuromuscular electrical stimulation to kind of help with getting a good contraction and kind of helping to re-educate that quad into, how to fire properly. And then we're going to kind of help you strengthen that and prevent some atrophy. So I think it's going to really help you kind of progress along, with the rest of your recovery. So some of the contraindications for this would be if you had a pacemaker, we wouldn't go anywhere near that. If it was a female patient and they're pregnant, we wouldn't go around the belly or the lower back. We also don't want to go around places that have any sensory deficits or sensory issues. So with him having an incision from his ACL surgery, that would be a relevant contraindication to his case. So we would examine his incision, ask him if he can feel around that area.
Yes.
Can you feel around there? Okay. So then in that case, we can still use it. So for this, to get the quads for knee extension, we're going to place electrodes up on your quadricep. It's a very safe procedure. I think it's going to be very helpful. So do I have your consent to try this out on you?
Yeah.
Okay. Sounds good. So then I'm going to place the electrodes. I'm going to have to bring your shorts up a little bit. Perfect. Thank you. All right. So I'm going to place one of the electrodes here. And we're going to try to place them over the motor end plates so that we can stimulate. Yeah. So that we can stimulate, so we can have the electricity kind of activate where we have the most neurons there to fire for contraction. Because the goal of this is to get a good, strong contraction. So if you come over here to the machine, we're going to get set up. So we're going to use a biphasic pulse current symmetrical. So we're going to get that set up. I'm going to go with a 10-50 duty cycle. So we're going to go for a 10-second contraction with a 50-second rest period. I'm going to come over here. The timing being 10 minutes sounds good. That'll allow for 10 contractions. Our frequency, we're going to bump that up to around 280 in this case for a nice smooth contraction. And then our width or our pulse duration, we're going to bump that up to 400 microseconds for this. All right. And then for our intensity, I'm going to bring this up until Kevin feels a pretty maximal contraction. So we're just going to go for patient tolerability and comfort with this. So I'm just going to keep bringing the intensity up until Kevin feels a nice strong contraction and reports that that's as far as he wants to go. Then I'm going to start the cycle, and I'll have a 10-second contraction, 50-second relaxation. So Kevin, I'm going to start bringing it up. So you should feel like a soft tingle first before you start getting into the contractions. So just let me know when you feel a tingle, and we'll go from there, okay?
Okay. I feel a tingle.
You feel a tingle? Okay. We'll go a little slower there. And you just let me know when you feel the contractions. Alright, I see you're going a little bit. You feeling okay still? Does that feel? Do you want a little more? Right there? Okay. We'll start your program then. Alright, so I'm going to have Kevin try to squeeze as hard as he can with these contractions as well. All right, and then we're going to respond to him saying he wants it down. All right. So we're going to It should relax here pretty soon for you. There you go. So the next time that you get a contraction, I'm going to want you to like push your knee as far into the table as you can. Because it's going to kind of help. The electrical stimulation is going to help that muscle contract, and then you contracting with it is going to kind of help solidify that re-education of that area.
Okay.
Yeah, so to get these contractions, we're stimulating your alpha motor neurons.
My alpha motor neuron?
Yes. Those are the neurons at the end plates that help with firing your musculature and causing this contraction. So those are the nerve fibers that we're trying to stimulate with this treatment. All right. Should be pretty soon here that we get our next contraction. Yep. Just remember to push your knee down into the bed as much as you can. All right. Okay. We'll do one more contraction with Kevin. Yes. So, yeah. So for this treatment, since it's 10 minutes long, we would be doing it for 10 contractions, but you could do this for up to an hour a day, 3 to 5 times a week for 4 to 8 weeks as a treatment plan if you wanted to. But for the purposes of this demonstration, we're just going to do one more contraction here, and then we'll wrap the video up. That should be pretty soon here. Just remember to fire along with it. Alright, there we go. So we'll stop the machine for him. Yes, so thank you, Kevin. And we'll check the skin underneath the patient's leg, make sure that we're still, looking good. Everything's healthy. There's no red spots or anything like that. So we're good.